everyone. My name is Veronique Mead, and thank you so much to Guy McPherson of the Trauma Therapist Project for inviting us. I'm here with Efu Nyaki, who was born and raised in Tanzania, and she is a faculty who teaches somatic experiencing and also family constellations work. Efu, I am so glad to have you here with us today.
Thank you so much, Veronica. When I read your message, I was very happy that I was able to find the time for you.
I am glad too.
Yeah.
Yeah, because you teach all around the world. And you've been in Brazil for the past 30 years. You were co-founder of a healing center called Afya.
Yes.
And I learned partly about your work. My own is working with folks with chronic illness and the trauma connection. And what I really wanted you to share with us today is your chapter in your book, the kind of work you do with asthma. And I'm thinking about adults with asthma and the components of work that you do.
Yes.
Tell us.
You. Yes, thank you very much, Veronica. I'll go right into this part. Yeah. Because I was when I was writing my book, I decided to include asthma because it's something that I have worked with many people. So I had a good examples that I could put in a book. So I thought this will be important to help people around. Yeah. So that was major reason to put this chapter in the book. So I have encountered a lot of people, children or adults, that have asthma, and they go into crisis a lot. And when they go to crisis, actually, when they have something that reminds them of the trauma itself they encounter. And oftentimes, I will put it that way, oftentimes, the people, whether it's children or adults, have asthma, they're the people who had trauma, developmental trauma, and they were separated from their mother at some time. And actually, it's not just from the baby stage. For me, I have learned more that those who were separated at a certain age, for example, a year and a half, between a year and a half, up to 2 years. That is the time the child has already begun to understand, to know the mother is leaving, the mother is coming back. And then, of course, when they are separated, there is some kind of frustration and anger that coupled together, fear, frustration, anger. And that is a lot, it's like a shock trauma. And this shock trauma shocked their system, and especially the lungs, because when they cry, they're not able to take in the air, and that suffocates their lungs, and they actually get inflammation because that affects directly their lungs, and they have inflammation. And so once they have that, that comes back and back many times. It can be, you can go to the hospital or to the health post and get some medication, but it doesn't heal because you have to touch into the roots. Yeah. So this, in a way, what I'm talking about here, this, in a way, it is a shock trauma. At the same time, it is a developmental trauma. Yeah.
The timing is a big part of it.
The timing is
early. Yeah.
Early, not early like babies. Sometimes those who were separated from their mothers at the baby stage, like they're just born and separated, they might have asthma, but it heals more easily. Even the person who adopt those children or take them at the early stage, taking them care of them. Here in Brazil, they take them to the beach early morning and have that energy of the salt and air. It heals their asthma right away, because that comes from the sadness. But when they're in that stage, where they actually recognizing a little bit, my mother did this to me, or my mother separated to me. They get very confused because they cry so much when they can see the mother moving away, or the grandmother taking them, or the aunt taking them. Yeah. And then that is very painful for them. So that sadness, they shut down the breathing process. And therefore, what happened to their lungs? The lungs is completely affected. And therefore, they remain like that. And so every time they remember their mother, or they remember the episode, the traumatic episode, then they start having crisis. Yeah. Whoever is taking care of them could do all the best they can, but still doesn't heal, because they need to heal. They need the connection with their mothers. Yeah. So when I receive this kind of people with asthma, I don't take them during the crisis, because during the crisis, I'll just give them we have herbal teas here. We have mud therapy that warm their lungs. And it's like your mother's touch, whatever, because it's a warm mud therapy. But then as they get better, then we can actually work with them. And what we do the most is to help them to reconnect with their mother. So now, since at that age, 2.5 years old, they create some kind of tantrum and a very anger. It's really anger and resentment with their mother. Therefore, it is very hard for them even to just advise them that, like to just preach, like, forgive your mother or let go of this. It's not easy. Yeah, remember that. So what we do here now, so we do somatic experiencing, where they can notice their body, they can take deep breaths very gently. They can notice when they are going to have crisis, and they can notice when they can get better. So the somatic experiencing, in a way, is helping them to learn how to deal with the moments of crisis, to deal with the moment when they are going to go into this process, and that they can bring themselves out of it. Now, for completely healing, we actually use Family Constellation System Therapy. And Family Constellation System Therapy has what we call the orders of love.
Orders of love.
Orders of love. Orders of love are wonderful, really. I love them. I think it's it's a path, spiritual path. Because we talk the orders of love, as Beth Hellinger, who is the founder of Family Constellation System Therapy, speak or put it. These are the orders that are among us, or that we can observe in the nature and among ourselves, so that love can flow. Yeah, for the love to flow, one should honor, reverence those who came before them, mother, father, ancestors, and so forth, or even older sisters, reverencing, yeah? Reverencing so much, yeah? And the second order, so when you do that, the love flows, and people feel very holistic, they feel healed. And the second order of love is that everybody has a right to belong, and to belong at the right place. It's a justice to make sure that we let people belong. We allow people to belong, and we also make sure we have our own rightful place. Because when we allow everybody to belong, then love also flows. When there's somebody excluded, love stops there, where there's an exclusion. So everybody has to be included to be whole, and then the love flows. Yeah. So that is the second order of love. And the third order of love is that we'll have to learn how to receive from our parents and give to the world what we have been given from our parents. We don't give it back to the parents at all, because they're big, they have enough. We give it to the world, and the world give it back to us. Yeah. So that we create a harmony of balance between receiving and giving. Yeah. So when we use this adult might have so much anger, so much frustration with their mother because probably the mother had many children. I mean, she had two. She had this child, and while she's still breastfeeding, then another child comes. So the grandmother said, "Come on, this one I can help you to raise." Well, of course, the grandmother is doing a big service, but the child is pulled out from the mother before it's ready for that. So that's where the big anxiety and pain and resentment comes in. And then that creates the asthma, that because it's a shock to their system. And psychologically, they already know what's going on somehow, and that's what happened. So now, just telling them you have to respect your mother is not enough. But if you begin to bring the awareness of the orders of love, and they actually do it, like I have an example in the book, of course, in the chapter I put there. So, for example, if you do that, you ask your client, she said, "No, my mother, what she did, she didn't want to keep me. No, I don't want to talk to her. I don't want to see her. I'd rather stay with my crisis with asthma." Yeah. And then we just say, okay, now according to these orders, if you just do that. If just let your head go down slowly, very gently. There you go. Did you see there was a deeper breath? It's
I did.
amazing. So that deeper breath immediately helped them to feel better in their lungs. So the breath comes in when we allow our head to go down gently. And this movement of going down is really what we call reverencing, yeah? Like recognizing that they came before us. I have to bend a little bit. So when they begin like that and they feel, they took a deep breath, they feel good, they said, okay. Well, is that all? We said, well, we can begin with that because they already feel good in their physiology. You see what I mean? So they go down, and then they feel really good. They say, wow, maybe I can stay like this all the time. And from this place, that's where they actually feel like, yes, I can say thank you to my mother.
From that place.
From that place.
Because part of the challenge, I suspect, and from people I know with asthma, it's not known. A lot of the time, people have no idea that there's any connection to the past, to the mother, to feelings, to overwhelm, to things that happen as a child. And this is what I find fascinating about the trauma work is you're working somatically with sensation. And in the family constellations, you're working with a system, a bigger system.
System. Yes.
The orders. Mm-hmm.
The orders. And now, thank you for bringing up the whole question of the bigger system. Because then I'm helping them to connect with the mother. But then they might say, no, I want my grandmother. I said, no, okay, yeah, the grandmother will come there, but let's put her in the order. Right? So you can imagine the mother is here. You are here in a lower place where you're actually bending. And above you a little bit is your mother. And above you, there's a grandma. So you can actually feeling them kind of blessing you, like a waterfall coming down. And the air comes up in the nose much better. Really, when people are in the crisis, they try to go like this, right? They're looking for air to breathe. The best way is to help them kind of let the head come down slowly. But this is already reverencing in itself. But also, biologically, anatomically, I think the nose picks the air from this way, from here to even lower. When you go up too much, the air doesn't come into the nose. Yeah, you can try that. Yeah, try that and then go down slowly and notice. Do you notice that? Yeah, they've discovered this even with the COVID, when in some hospitals in India, I teach also in India, they discover that they didn't have any more, you call that ventilator, too many people. So for some reason, they discover that if they put the client like this, the client had breathed better. If they, all the patients, if they had them lying like this, the clients had difficulties in breathing. So they were now putting the clients like this, and they were able to serve a lot of clients that way.
Wow.
Yes.
What I've seen and what you write about in chapter 8 of your book, and your book is called, let's see, actually, where did I write it down?
Here, I
Healing
should.
trauma. Oh, good. Yes.
There you
Healing
are.
trauma. Healing trauma from family constellations or through family constellations and somatic experiencing.
Yes, that's it. Exactly. Yeah, that's it.
Chapter 8, you talk about this example with Maria Jose.
Yes.
And how what your work is doing is it's not just this movement, it's a whole system where you work with SE with the individual. You did at least 6 sessions with her.
Right.
And then it seemed like she might have been ready. And then you set her up in a group family systems setting where you had her pick someone to represent her mother. And there was a whole process around that.
Yes.
And so you're really combining the ancestral component, the individual trauma component.
Yes.
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 And we're coming towards the end, and I wonder if there's anything else you'd like to say, maybe how this combination of work works for other symptoms, other illnesses as well.
Yes, I mean, I would say exactly. That's you're very right on how we begin first with individual sessions where you can talk to client, you can touch, you can help them what we call to have felt sense, to feel their own body, to know how they're feeling. And that's why those first sessions are really good to prepare them. And then when they come to a public where there's a group of people, where they picking up people to represent them, that is a family constellation system therapy. And they just sit and observe.
Yes.
Their own behavior and their own what they have developed after trauma. And then they can see the person representing them changing, and therefore something in their cortical brain come into their awareness, and then they change. When they go back, even if their mother is alive or not, they're able to do a little process to connect with their own mother. And then they start feeling better. Yeah, and this is not only for the asthma, of course, particularly because asthma is a respiratory disease. I kind of mentioned that because breathing in is life. And mother is life. She's the one who gave us life. I wanted to make that connection. Yeah. And it's so beautiful. So when they just begin to feel life, alive, and with lots of life, when they can reverence the life that they were given. And other diseases come into it, like cancer and mama, mammary gland cancer. When you come to that, it also has to do with the mother. Yeah, that's another area we can talk about. But many of them really, we go into this place of reverencing, and then you have a community together. And everybody, anyway, I want to say this last thing is very important. Family Constellation System Therapy is amazing,
It is.
because, you have a group of people, 15, 20, I don't know, in a room. One family constellation heals everybody who is there and maybe beyond, and those who are not even there, because everybody who belong to that system are healed, and the representative in their system are healed, and those who are watching, they also say, oh, that's for me. So it's a method that is healing the entire society. Yeah, that's very nice.
Yes.
Yeah, exciting.
Thank you, Efu. Thank you so much. Why don't you show your book again? There'll be a link in the notes, in the show notes, and links to your website and a little more detail about your biography and how you teach all over the world.
Yeah.
Thank you so, so much.
Yes, yes, yes. Thank you. Thank you very much. And I'm grateful.
Me too.
Bye.